Okay, I think we're going to get started now. I see the numbers of participants are climbing, and they'll have a couple more minutes while I introduce our panelists and we'll get started. So welcome to the Three Revolutions webinar series, part of our Climate and Equity webinar series related to the Three Revolutions Policy Conference that was translated into a series of webinars. We are so happy to have you here joining us and to talk about this important issue of the public health dimensions of the three revolutions in transportation. And those three revolutions, for those of you who are unfamiliar with them, are automation, shared mobility, and electrification. So we see those as an important sets of innovations that are intersecting to bring innovation to the transportation space. Of course, those innovations also come with a number of challenges, and today we're going to discuss some of those challenges and some of the opportunities that are associated with three revolutions in transportation. My name is Molly D'Agostino. I'm the policy director for the Three Revolutions Future Mobility Program here at UC Davis, which is a program that is housed at the Institute of Transportation Studies, where I am today, and also at the Policy Institute of Energy, Environment, and the Economy at UC Davis. I'm joined by some really fantastic guests here. Dan Wu is the Health Program and Policy Specialist for the Office of Health Equity for the California Department of Public Health. Alex Guinness is the Director of Accessible Climate Strategies. And David Rojas Rueda is an environmental epidemiologist at Colorado State University. Each of these experts come with a really unique set of perspectives on this topic of public health and the three revolutions, shared, electric, automated travel. And we'll get into some of those today. We plan to talk for each of the panelists to give a 10 to 15 minute presentation, followed by a Q&A. And we did ask for people to provide questions in advance. You can also use the Q&A box at the bottom of your Zoom panel to submit questions during and after the presentations. So thank you so much, and we'll have Dan Wu, Health Program and Policy Specialist for the Office of Health Equity for the California Department of Public Health, begin our presentations today. So Dan, when you're ready, please share your screen.
Pull this up. Right. All right. Everybody able to see this okay?
Dan, swap your screens because we're seeing the presenter version.
Oh, I see. Cool. All right.
Perfect, thank you.
All right. Minimize this a little bit. Okay, great. Thanks, Molly, for the introduction, and it's great to be here with you all today. So as Molly mentioned, my name is Dan Wu, and I lead the transportation policy and planning work at the California Department of Public Health's Climate Change and Health Equity program. So we're based in the Office of Health Equity. So our climate and health program works to assure that California's actions to prevent and prepare for climate change also improve health outcomes and increase equity. For today's talk, I want to provide some high-level framing and context for thinking about public health and health equity dimensions of the three revolutions. I also plan to provide some health equity considerations to help inform policy development, particularly around connected and highly or fully automated vehicles. So we're talking about levels 4 and 5 automation. Quick disclaimer, the content of views I share today are mine and don't necessarily reflect the official positions of the State Health and Human Services Agency or the Department of Public Health. So to start, I'm going to get into a little bit of the conceptual side of things and talk about how our Department of Public Health approaches the work around health equity to kind of ground things a little bit. So we focus on addressing what we call upstream or social determinants or root factors that affect people's health with an emphasis on improving living conditions through policy systems and environmental changes. The goal is to improve population health outcomes, particularly for people historically marginalized and disadvantaged. This means that health doesn't just start in the doctor's office. Our life expectancies are tied to the social, economic, and environmental conditions of where we live, work, learn, and play. This includes factors like income and poverty, housing, transportation, but also things like civic participation or the experience of racism and other factors. And we know there are persistent, unjustifiable inequities or unfair and preventable conditions in our society that lead to large differences in the health of certain populations. So providing everyone the same often isn't enough, as shown in the graphic here. Equity then is about providing what's needed, and health equity is full and equal access for all people to opportunities that enable them to lead healthy and full lives. So we approach our transportation work using this health equity lens. We're interested in questions like, how do you ensure that all people have full mobility options to enable them to lead healthy lives? What are the health impacts associated with our current transportation systems? How do we make sure that all people's mobility needs are met? So I also want to take a step back for a moment to look at the broader context of the top causes of death here in California and across the US, and how transportation can play a part in addressing. So while we're currently focused on the devastating effects and numbers of deaths from the pandemic, the vast majority of deaths are due to chronic diseases like heart disease, stroke, cancer, diabetes, obesity, and chronic respiratory ailments. More than 1 in 3 Californians live with at least one chronic condition, and around 80% of total healthcare costs in California goes toward treating chronic conditions. What we're seeing with COVID-19 is that many of these underlying chronic conditions increase people's risk of serious illness or death from the coronavirus. And we know that physical inactivity is a primary cause of many of the chronic diseases that we see, and approximately 23,000 deaths per year in California are directly tied to not getting enough physical activity. In comparison, about 5,400 deaths per year are due to air pollution. But many of these chronic diseases could be prevented or reduced if our environments facilitated greater levels of safe physical activity. The US Surgeon General recommends that adults engage in at least 150 minutes of moderate intensity physical activity each week. So that is like taking a brisk walk or some light activities that raises heart rate. So what role does the transportation sector play? And again, physical activity through active transportation, such as walking, cycling, and even taking public transit, which often includes some component of walking or physical activity to get to or from transit stops and stations. So, trips by foot or by pedals help to increase our physical activity level and can also replace car trips that also has benefits for air quality and in reducing carbon emissions. So key question then is, how might the 3 revolutions affect transport-related physical activities? So other ways that transportation systems can affect our health include how safe we feel in our streets, as well as traffic-related collisions, injuries, and death. Traffic congestion. I think many of us are not big fans of being stuck in traffic. It definitely impacts our stress levels and mental health impacts. Other aspects include the ability to access our daily needs and services. So in my past work related to providing healthcare services to lower resource communities, aside from cost, one of the main reasons patients provided for not going to see a doctor was that they simply didn't have an easy way to get to the doctor's office. So transportation-related expenses itself can affect people's financial well-being, and that then affects their ability to afford other essentials, leading to potential negative health outcomes. And on a broader level, transportation infrastructure investments and improvements can provide community benefits, but they could also contribute to neighborhood gentrification and the displacement of lower income residents. Social cohesion and maintaining healthy relationships are also dependent and often influenced by the transportation options that we have. And then there's climate change. 2020 is on track to be one of the hottest years on record. Here in California, we've seen record-breaking heat and rolling blackouts this summer. And along with other Western states, we're facing catastrophic wildfires and choking smoke. California's transportation sector is the largest emitter of greenhouse gases, contributing over 40% of total emissions. So we won't be able to tackle the climate crisis without addressing the transportation sector. So some of the questions that we're interested in exploring is how might the three revolutions affect transport-related health effects, and also how might the three revolutions affect efforts to address climate change. So in terms of equity, we know transportation-related health benefits and harms are not distributed evenly among populations. Housing and transportation decisions made over decades, often guided by structural racism, shape the design and build out of many of our communities and transportation systems. So this has led to inequitable impacts and significant health disparities among Black, Indigenous, and other peoples of color. Examples of policies and practices guided by structural racism include redlining by the federal government that actively prevented people of color from being able to own homes in predominantly white neighborhoods, as well as the construction of highways that literally tore through existing communities of color. So what we're seeing today then includes disproportionate numbers of Black and brown communities living near sources of pollution. Black Americans are exposed to 1.5 times more particulate matter, largely from fossil fuel sources, raising their rates of asthma and other respiratory and cardiovascular conditions. On top of that, lungs damaged by air pollutants, particularly PM 2.5, are more susceptible to respiratory illnesses like COVID-19. So we see similar inequities with traffic-related fatalities. People of color, older adults, and those in lower income communities are disproportionately struck and killed by drivers compared to the US average. So given all this, it's important to ask what role can the three revolutions play in addressing transportation-related health inequities? So what kind of a transportation future will the three revolutions bring? Many of you have probably already heard experts, including many from UC Davis's Institute of Transportation Studies, describe scenarios ranging from dream to nightmare. On the left, we have the dream scenario looking at self-driving vehicles that can potentially improve transportation affordability and access, including to daily needs for those who don't or can't drive. We could reclaim time that we currently spend driving. You can watch a movie or take a nap or take care of some emails while you're riding. Improvements to traffic safety and reductions in collisions, injuries, and death. We could see significant improvements in air quality, as well as reductions in carbon emissions. Shared and connected AVs could reduce the amount of parking and right-of-way space in urban areas, so that can free up these spaces for other land uses like infill affordable housing or maybe more active transportation infrastructure, helping to increase the opportunities and help facilitate more physical activity, ultimately leading to better health outcomes. The nightmare scenario, on the other hand, we could see potentially, new or worsening of transportation barriers and more inequity in terms of distribution of transportation services and resources. So for example, access being effectively limited to those with financial means or greater wealth. We could see automation replacing jobs, jobs loss, dramatic increases in driving and sprawl and the associated emissions of air pollution and greenhouse gases, or an increase in sedentary lifestyles where we're shuttled around to a lot of our activities, again, leading to worse health outcomes and shorter lifespans. So whether or not we reach the dream scenario will depend on many factors, including, continued technological innovation, safety, the cost, consumer trust and acceptance, as well as developing policies and regulations around how we deploy these new technologies and services. And the reality is many aspects of today's auto-dominated transportation systems are simply not healthy or equitable. And were in part the result of insufficient government regulations that enabled corporate interests to drive a lot of the transportation agenda. So we're at the cusp of another transformation for our transportation systems. And this time it's critical that government and policies can adequately protect the interests of the public to have safe, affordable, healthy, and equitable transportation options as we continue to advance innovation and promote these new technologies. Here in California, state government agencies have worked together to develop a set of automated vehicle principles for healthy and sustainable communities, which summarize key principles aimed at aligning California's automated vehicle policy with state goals for climate, air quality, health, environment, land use, quality of life, and equity. In addition, there are ongoing interagency discussions regarding the deployment of AVs in the state. So as these efforts continue, an important part of informing AV policy development is to look at the associated potential health and equity impacts. So for my last slide, I just wanted to show this list of health equity considerations. It's not meant to be an exhaustive list, but a starting point. I won't go into detail for each one, as my colleague David will be covering more of this later, but I do want to highlight some of the key areas to think about. So I already touched upon physical activity and active transportation. Again, about 9% of annual deaths in California are associated with a lack of physical activity. Traffic safety, improving traffic safety is perhaps one of the biggest potential benefits of AVs. But we also saw in 2018 in Arizona, the first pedestrian killed by a self-driving test vehicle. So how do we work to prevent that from happening again? User safety within vehicles. So how do we ensure the personal safety of passengers, particularly in shared environments with strangers? Are there additional measures needed for certain populations like children traveling alone? How about data security and privacy? Transportation equity and accessibility. Again, we're including mobility and physical accessibility for those with disabilities, which my colleague Alex will address in greater detail later in the panel. This also includes economic accessibility, who gets to use, own, and operate. How do you ensure access regardless of location or geography? What are some of the potential challenges for rural communities? And looking at existing technological barriers and the digital divide, gaps in wireless services, those can pose challenges in fully deploying these in an equitable way. We have an aging population with increasing mobility needs. How can the three revolutions be part of the solutions? I touched upon air quality in the scenarios, as well as potentially increase or helping to reduce the amount of driving with shared mobility and the associated emissions of greenhouse gases. Public transit is something that we're thinking about a lot. How might the three revolutions replace or supplement public transit trips? Employment and jobs. We know that income and jobs are one of the major drivers of health outcomes. So how will AVs impact, transit drivers, truckers, and other vehicle operators? Alternatively, what kinds of new jobs could potentially be created? Mental health, noise, emergency response. In our current pandemic circumstances, there are definitely concerns around health and safety in shared enclosed spaces. So what measures might be needed to reduce the risk of disease transmission? On the other hand, how can the three revolutions assist with emergency response and recovery? This past April, neuro driverless vehicles were deployed to deliver medical equipment, clean linens, and food at a temporary surge hospital in Sacramento. So what about the utilization of AVs for emergency response and evacuations, for example, in the event of wildfires and hurricanes? And community engagement and decision making, right? We know that communities are different. How do we take into account and address their different mobility needs, challenges, and opportunities? What do communities themselves think about how new technologies like AVs should be deployed? Meaningful community engagement and decision making can take more time and resources on the front end, but there are many benefits that could result, including building community trust and support in deploying or considering the deployment of these new technologies, as well as identifying problems and gaps early on and coming up with appropriate solutions. And again, there could be other potential or unintended health impacts that we just won't be able to anticipate. So how do you evaluate and effectively respond to these health and equity impacts as they arise? So thinking these things through and having them help inform the deployment of new mobility technologies and services can help to ensure that the three revolutions reach their potential in providing benefits to society, public health, and equity. Thank you.
Thank you so much, Dan. And you know, there's so much to unpack there. We've got a lot of questions that are relevant from the audience. So please continue to submit your questions in the Q&A box, and Dan can address them during the next portion of our session. The next speaker I'll introduce to you today is Dr. David Rojas Rita. He's a physician, has a master's of public health, a PhD, and is an environmental epidemiologist at Colorado State University. So certainly a scholarly member of our panel, and we look forward to you informing us about your research and how it relates to the three revolutions. So without further ado, David, please share your screen and go forward with your presentation.
Hi, everyone. Thanks, Molly, and thanks, UC Davis, for the invitation to be part of this seminar, a webinar, I will say. So I will give a little bit of introduction to some of the topics that Dan already described to you, and go a little bit more in detail and try to provide the more epidemiological evidence on these links between the three revolutions in transportation and health. So when we think about health and transportation, we often think about cars, air pollution. Sometimes we think about active transportation, physical activity, like the case of the polluted bicycle systems. Less often we think about public transportation as a tool for public health to improve prevention, improve the risk of injuries, accidents, incidents, traffic safety, thinking that public transportation is the safest mode of transport in the urban areas. But almost never we think in terms of the built environment. And the built environment is highly correlated, well-known, related to transportation. And all of them are related with the health in different ways. So when we think in urban policies, urban design that affect density, land use, transport infrastructure, the availability of vegetation, nature, green spaces, these determine how we behave in the urban settings. The amount of time that we spend indoors or outdoors, which kind of mode of transport we choose if we do physical activity during this transport mode. And this finally affect different pathways or exposure, what we call social determinants of health. In other words, like the amount of air pollution, traffic noise, the exposure to heat, the extreme temperatures, UV radiation, and of course, the level of physical activity, the social interaction, the cohesion that we have, the stress. So all of these determine different health outcomes. And we can classify these health outcomes in morbidity, that is more the diseases, different type of diseases that are well known linked to all these exposure pathways, and also injuries, acute and chronic diseases or disabilities. And having all or any of those health issues will increase the probability for a premature mortality. So, and it's also important to highlight that all these pathways also increase more risk for those that already have any of those diseases to increase the risk of mortality. So there's many ways that health and transport and the built environment are connected. And of course, we need to put all of this in context of the socioeconomic context in terms of the setting, the geographical location of population, cultural, demographic, the genetics, of course, and the health services, the quality, accessibility to those health services, and of course, the environment. So, but how we can know and what is the amount, the real amount of health that is linked to those different pathways. So in this case, we did a study in Europe to try to assess and quantify the number of deaths or premature deaths that these different policies could actually impact, reduce, or increase. In this case, one of their revolutions was to implement a successful policy across several cities in Europe of the public bicycle systems. So we include 12 different cities and 12 different systems with more than 2,000 bikes. And what was the aim of this study is to actually quantify the health impacts for those that actually shift from car to the public bicycles. So one of the main aims of this specific policy is attract these car drivers and passengers, reduce traffic jams, emissions, air pollution, and of course, improve physical activity. So we wanted to see really the amount of benefit when these people actually shift from car to public bicycle. We include mechanical bicycles, but also electric bicycles. So this is another dimension of the revolution, electrification. We know that electric bicycles provide some help, assistance to the cyclist. So probably you are not doing all the physical activity related with a normal mechanical bicycle, and you go a little bit more fast, and probably you will be exposed to more risk in terms of traffic injuries. So we quantify these different pathways or exposure, traffic fatalities, exposure to air pollution during this commuting and transport period, and also the amount of physical activity in all these systems. And we quantify finally the mortality and the economic assessment of the economic values related with mortality. So what you see in this graph is these blue bars show you the amount of deaths or premature deaths can be prevented or postponed each year due to the physical activity done in this by these cyclists in these bike sharing systems in each of the cities that we include. So you see there's a variability of the benefit. This is the number of deaths that you can prevent. And we also include the number of risks, the amount of risk that actually could happen when you jump on these kind of bicycles. That could be you are inhaling more air pollution, you're exposed more to this harm, and this could increase your probability to die. But also you're jumping to this bicycle and you could suffer a traffic injury or fatality. So this is taken into consideration. So what is one of the main aims of this study also is compare risk and benefits, because there are risk perception that actually jump on a bicycle in an urban setting is not good for health. So what you see here is that in some cases, the benefit outweigh the risk in 17 times. So in all the cases, was worth it to actually jump on a bicycle. And actually all the systems provide important public health benefits. And this is only captured mortality. We did something similar related with public transportation that is maybe not a new revolution, but it's something that is already happening, and we are sharing this kind of vehicle. And we include 8 different cities around the globe, and you can see again here risk benefit, and most of the benefits, similarly to what happens in the public bicycle system, come from physical activity. So, and this is very important consideration for public transportation. Just walking these 5 minutes from home to the station and from the station to the final destination provide this health benefit. There are other health benefits related with public transportation, like reduced risk of traffic fatalities, and depends on the city where you are located, maybe the exposure to air pollution will be less. So what happens with the relationship between transport and the built environment? And see what you're seeing here is actually the street network, a common city, in this case is Barcelona in Spain. And you see that most of the public space is dedicated for cars. So in this case, the mayor of Barcelona wanted to implement an intervention, and they wanted to reduce around 60% of the streets and ban cars for these streets and dedicate these streets and public space for pedestrians and cyclists and create new parks, plazas, and green areas. So they asked us to do this specific assessment. What will be the implications if we apply this policy across the whole city? And you can see here the before and after of this intervention. Before, you have these cars going to the specific street, and this is a pilot in one district of the city of Barcelona. And at the bottom, you can see a better urban space for pedestrians, cyclists, and of course, benches and trees. So they wanted to implement that policy across the whole city, all the neighborhoods and districts. So what we did is measure the current levels of air pollution, and what you see now is the map of Barcelona with the current levels of air pollution. In this case is nitrogen dioxide, and the darkish areas are the areas with highest concentration of air pollution. We compare and model what will happen in the future if they implement this specific intervention in the built environment across the whole city. And you see the changes in colors. That means that improvement in air quality. We did something similar for road traffic noise, the amount of green spaces, and the heat island effect. And we quantify that in terms of mortality. And again, we estimate that if this policy will be implemented across the city of Barcelona, more than 600 deaths could be prevented or avoided each year due to the changes in the built environment and the mobility and the transportation impacts. So more locally, this is another example of these changes in the built environment. And this was a request of the US Forest Service, where we helped create different scenarios to quantify the scenarios of greening the city of Philadelphia. So this is a map of the city of Philadelphia. You see the two different circles. In the left, one part of the city with less amount of trees, and in the right, another part of the city with more trees. So the city of Philadelphia have a scenario to actually increase the tree economy for 2025. So in this case, we quantify the health impacts in terms, again, the mortality to increasing the greenness and the change in the built environment. So, and this is the amount of deaths that could be prevented each year if they increase 5, 10, or 30% of the tree coverage in the city. And we translate that in economic values. And the best case scenario, they could, if they achieve the 30% of tree coverage across the city of Philadelphia, more than 700 of deaths, of premature deaths could be prevented. And that means more than $6 billion annually. So the new revolutions, the new technologies in transportation offers an opportunity and changes for public health itself. There's something that will come in, but in some cases, and this is the case of Waymo, that already are here. This is not something very futuristic. It's something that in Phoenix is already implemented a pilot. And we create this framework to try to link direct and indirect health possible impacts of pathways between these shared autonomous vehicles and health. So we started with the direct impacts, and what we refer with direct is those impacts that will happen with the traveler, those that are actually using this specific vehicle. We know that there is something that is very important and highlighted by the industry and the sector that works in autonomous vehicles, that one of the main reasons to push for this implementation is traffic safety. This will be a really important pathway to improve public health. We also, if these autonomous vehicles is shift to electric vehicles, we can benefit for emissions, excess emission, and also traffic noise. So these electric vehicles will be more silent and will produce less road traffic noise. Another benefit could be if these electric autonomous or shared vehicles could be social interaction. So social interaction, There is a lot of evidence in social epidemiology linking the number of the relationship and the number of contacts that you have in your neighborhood, in your school, in your workplace, and the improvement in immunity and the risk of mortality. So this could be a good benefits of this specific intervention, but we are finding that there is other risks. So this is not only benefits, there are risks of these specific technologies. So in terms of emissions, there is not only the exhaust emissions, like even the electric vehicles, due to the friction of the wheels with the streets, the roads, and the motor, the engine also produce some kind of particles. So we need to take into consideration this kind of other emissions. Physical inactivity, if these new technologies are substituting active transportation or public transportation, could reduce the level of physical activity or the opportunity to do this physical activity. Another thing is the electromagnetic fields. So these electric shared autonomous vehicles could have a lot of devices, instruments that produce this kind of electromagnetic fields. And in environmental epidemiology, we have found that there is a lot of relationship between these disruptions in the more biological pathways, but also start to be translated in certain diseases. So this could be a risk to expose the population to that kind of risk factor. And there are other factors that we don't know what will happen. There will be a benefit or risk and work conditions, and Dan already mentioned that you have more time, you don't need to drive, maybe you're relaxing yourself, or maybe you're reading your emails, or you're working a little bit more. So stress related with that activities are also well known to be harmful for health. So it's a risk factor. If you add an extra 30 minutes an hour to your work time period, so you will add in an extra 30 minutes or an hour of stress in your daily life activities. And stress is bad. But the other face of that coin is that if you don't need to drive, maybe you are not a driver, you're a passenger, the level of stress actually reduces. So this could be a beneficial impact in terms of stress. And substance use and abuse, I will say, it's also a risk benefit that we don't know what happens in terms of that. So the risk perception of different substances like alcohol in the society have been helped by different law enforcement in terms of drink and driving. So we are more and more aware that drinking is bad for health, not only because the alcohol itself is bad, but also because increase the probabilities of a traffic accident. So if we don't need to drive a car because it's autonomous, maybe you don't have more of these laws that enforce the reduced drinking. So that you don't have this designated driver, and probably we don't know what will happen, but people could be more willing to drink more often, or more in terms of quantity, or any kind of other drugs. So these are the aspects. In terms of the indirect impacts, so access to services, this is something very important. And thinking in autonomy, the children, the seniors that have more opportunities, access to transport options, to access different services, and be part of that economy too. So this is in terms of social equity. So an equity and this autonomy, the access to services are also highly correlated with health. On the other hand, we have many other parts of the population that they have not the same abilities that we have, physical and mental abilities. And if those vehicles are designed in a good way, that they're inclusive enough to actually be used for the diversity of our communities, we will offer this as an opportunity for them to be part of the economy, a part of the society, and improve the social cohesion and inclusion. So also the indirect impacts will be the traffic congestion. So traffic congestion, these new technologies have been related with the reduction of the number of cars. There will be increased speed and the flow of the traffic. So this is related with the energy consumption, and energy consumption, greenhouse gas emissions, and climate change. Again, climate change highly related with the health impact is a risk factor for in multiple pathways, I will say. But traffic congestion, if we have less cars because we are sharing a single car, so we have more public and private space. So land use could change. and that will lead us to more healthy, universal, sustained urban design. So this is a great opportunity to shape our cities. So, and this is the link with the built environment. So see that transport technologies as a great opportunity, not only to improve transport and health, but also the built environment and health. How we are now designing our cities could change. And these are opening a new opportunity to improve our urban design. So we came with these two distinction between different formats and models of autonomous vehicles that could be more individual use or sharing use. And in the sharing, we also identify in the green boxes those modes or type of uses that could improve public health, because we'll help to reduce the quantity and the ownership of these cars. So we will have more free space, we have less congestion, and we have all the other pathways that I already mentioned before. So we came with this matrix and try to highlight again, sharing and electric will be the best for public health, and individual and non-electric will be a major risk. So we came with these 6 main recommendations. This is already included a paper we published early this year, and we have 21 recommendations, but this is the most, the main or the more important ones. So we came, and this applies not only for autonomous vehicles, this applies for the 3 revolution itself. So these new technologies will bring risk or benefits, and how we can maximize these benefits and reduce these risks. Will be setting in terms of the model, the business model, and how we implement this technology. And in terms of autonomous vehicles, if we make that vehicles electric and sharing, we could help to maximize the health benefits. Very important, these new technologies should be aiming to support public transport and active transportation and not substitute those. And this is the public transport system and the active transport opportunities exist, and they need help, and they provide health benefits. So if we design this implementation, supporting the current network, so improving the efficiency of the current networks of public and active transportation will benefit health. We need to prioritize these technologies in disadvantaged communities. Imagine there are many disadvantaged communities that don't have access to options to put nice quality frequency of active transportation and public transportation. So maybe this technology will help to fill that gap. But also, if they're electric, we can reduce the emissions and improve their quality. And traffic safety. Often happens that in those communities, they have more traffic injuries and incidents. So if this technology will reduce this risk factor, we can improve traffic safety in those communities. Also, this technology should contribute to more equitable, healthy urban design in terms of the built environment, thinking that they will free public space and private space. We don't need a lot of parking now. Maybe zonification will change, and we have more space to actually add more vegetation, nature, green space that already produce health benefits, improve the urban design to make it more universal and accessible. And finally, we need to implement all these recommendations before the implementation of the full implementation of these new technologies. So if we are doing that earlier, we have more opportunities to actually introduce all these recommendations. When all these intervention and technologies already are fully implemented, it will be very hard to modify any business model or implementation of those technologies. So this is my email. I'm happy to collaborate in anything. And thank you again for the invitation.
Thank you so much, David. This really fascinating presentation. I did notice one question that was related to your presentation that was very specific. So I thought maybe I would address that before we move on, and then we can move on to the next speaker. The question was about the slide in which you show the benefits and risk of bike sharing. The question was about how do we interpret that aggregated data? Is it aggregated on population level, or is this about the individual? And my assumption is it's about the population, but please continue.
Correct. So all these studies are at population level. So we don't know, when we start to do this modeling, in many policies that they're not already implemented, we don't know who is actually benefited for that specific pathway. For those that already happened, we can track who already benefited or what is the risk of who actually died for a specific traffic fatality. But these numbers try to provide more like evidence for decision-making process. That doesn't mean that we can assign this as individual risk. It's more like a populational risk perspective.
Right. Interesting. Great. You know, I think that there's more to get into on this, but let's save that for the discussion and continue on with our next speaker.
Hi, everyone. I guess I'm getting rolling right here. So I will share this screen. Can everybody see the PowerPoint? And I guess I will do full screen on this. So hi, everybody. My name is, let me see. Okay. So my name is Alex Skenis. I am the Director of Accessible Climate Strategies located in Berkeley. And I personally have a disability. I have a C5-6 spinal cord injury, as well as epilepsy. And what I'm going to do today is not necessarily get into the nuances of the three revolutions and disability, but to set the context of how people with disabilities interact with the world, interact with the built environment, and then kind of transfer onto a quick discussion of what that means in the three revolutions, some of the activities that have already been going on. So here we go. So introduction to disability rights and the models of disability. One of the things, and by the way, when I'm talking about this, please just keep in your mind how each of these might relate to transportation. Because as some of the other speakers have mentioned, there is a difference between equality and equity. And pretty much everything does ultimately connect to transportation and how people get around the world. So first of all, disability is diverse. There are main categories and definitions would be the things that you'd find in government reports. These are the things you might find for the policy folks on here in climate change, health, vulnerability index, whatever that might be. So there are broad categories used by government and public health. You'll find mobility, visual, hearing, cognitive, psychological and emotional disabilities, self-care, and independent living. So these are kind of technical terms. There are subcategories, which could be like a medical specific. Oh, shoot. My mouse has a wheel scroller on it. Okay. So it could be medically specific. I mentioned I have a spinal cord injury, so I use a wheelchair, but if you see someone else in a wheelchair, they might have cerebral palsy, right? So there's different types of disabilities that fall within those broad categories. There's a time frame and severity of the disability. You'll find that someone that's had a disability for several more years might be more comfortable knowing about how to live on their own, knowing about how to manage medical things as well. People have different personal use of medical equipment. Someone might have a power wheelchair, a manual wheelchair. They might use a guide dog or a white tip cane, for example, if somebody is blind. There's intersectionality, and these are kind of classic terms, interactions with other characteristics such as race, gender, age, and income, and potential for multiple disabilities. I myself mentioned I have a couple. It depends on the onset of disability and the stage in life. One thing about intersectionality is pretty much every, otherwise what you would consider a disadvantaged group probably has a higher rate of disability. Communities of color have higher rates of disability. Elderly populations have higher rates of disability, and that shows up in the dangers and the inequities. So there's a personal experience. Somebody might have a relationship to their disability where it's sadness, they feel a little bit more isolated, or it's pride, and they really want to get out there and push disability rights. There's different trainings and practice on how to live independently, understanding of disability rights, and are there results of micro traumas? There's people with disabilities where they have to ask for help every now and then. They might have a friend that jokes about, oh, wait a minute, but really that's a micro trauma. We've seen that in a lot of our discussions about what's happening in America right now. And people, again, that can affect their ego, that can affect their comfort with their disability. Looking at this, and this is the breakthrough that we need to keep in mind when redesigning transportation systems is you have the medical model of disability, which basically says able-bodied is normal and others are inferior or broken. You know, this comes out of things like eugenics. You might have people who with disabilities are considered undesirable, outcast, hidden away. You know, this is a dangerous thing for society. It makes me uncomfortable. We're going to try to keep disability just out of the mainstream. You know, disability is treated medically, and a cure is ideal, and adaptive equipment is viewed as medical as opposed to supporting independent living. The big issue is this, fifth bullet point, which is the built environment does not need to be accessible using the medical model. I can't go upstairs, and the medical model says, you know what, you're not able-bodied, that's just the way that it is. We see that in transportation, and that's a big issue, so keep this in mind. And this last quote really is, you are broken, not the system. The social model says there's a range of abilities and the status could change. One of the founders of the disability rights movement said, you know, we're the only minority group that doesn't discriminate because anybody could join the disability crew at any time. There's a goal of inclusion and independence. There's positive disability identity and community. There's providing equipment and services as accommodations and designing with principles of universal accessibility. So actually, I'd invite everybody to look up 7 principles of universal design if you're ever, you know, putting together some sort of new transportation system, and ensure those are included. There's economic empowerment and supports to allow people to live, you know, more equitably. And you know, this is, the system is broken, not me. And here's just a classic, you know, a disability protest: fix the system, not me. I will say, with all the protests that we've seen, that I'm really grateful for all of the disability rights advocates that came before me and pushed for things like the Americans with Disabilities Act. You know, accessibility is a progressive thing, and we always need to be moving forward. So with that, accessibility and the social model basically identifies physical, economic, and social barriers as causes of oppression for the disability community. Barriers include physical inaccessibility, economic conditions, and stigma. When we're talking about physical accessibility and economic conditions, that, for example, transfers right over to transportation. If transportation isn't physically accessible, somebody's not going to be able to get on it. Their economic condition might make it so that they use the bus instead of you know, commuter rail that is more expensive. You know, with physical accessibility, you have mobility supports, accessible physical environments, signage and notifications. All of these things should be involved in any transportation system. Economic accessibility provides you know, social and economic mobility. And then social accessibility is awareness, inclusion, breaking down stigma and oppression. And I really encourage everybody to always reach out to the disability community, include them in workshops, because really this first person experience is valuable for designing transportation systems. Vital pieces in the built environment for people with disabilities. So here you'll see, you know, ramps. Paratransit has historically been an alternative to fixed route public transit for people with disabilities, and certainly, you know, it's for folks who have a hard time getting to the bus stop. It's for folks that might even have a hard time getting out of their own home. They need more personalized support. That's something that will need to transition and carry over when we redesign our transportation systems. And then social security, you know, this is financial support to make it so that people can, number one, live independently, and number two, you need money for transportation. So that's a great program as well. The things that we have are independent living supports, healthcare systems, social and economic inclusion, and accessible environments. I'm just going to jump down to the accessible environments, which would be buildings and housing, transportation, infrastructure, including things like ramps, technology as needed. I've got this headset. I use Dragon Naturally Speaking, right, to write things out on my computer, and that's their accessible technology. Technology will be in the 3 revolutions as well. So climate justice and the green transition, this is stuff to keep in mind always. So for mitigation and all of these actions about electric vehicles, etc., that is mitigation. I'm gonna do one thing. Okay, cool. I don't have a bright white PowerPoint on my face. So Evaluation methods for mitigation is going to be number one, identifying new and emerging technologies. Here, transportation, we've got all of those, right? Train and hire people with disabilities and have disability inclusive jobs. You know, I personally think that every company, every government agency should have some sort of disability specialist or access coordinator, or even, you know, a partner organization that they're able to reach out to. Consult with the disability community on design. At my previous job, we had a lot of workshops looking at the Bay Area's disability design transportation, and got great feedback from people. So definitely engage the community. Identify shortcomings and opportunities. There's a lot of both potentially in the three revolutions. Redesign for universal access and multiple uses. And then finally, support people with disabilities through awareness, affordability, and advertising. You know, people with disabilities might not know about pod cars. They might think immediately, oh, pod cars are probably not accessible for me. I'm not even going to try it. And then that is disadvantageous to those folks. With adaptation, and again, transportation is part of adaptation, you look at number one, disability characteristics, and go back to, what is it, the first or second slide that I had where I was talking about intersectionality. So look at disability characteristics as well as other personal characteristics, how that relates to the built environment, what climate impacts you are trying to adapt to, you know, primary and secondary impacts. I live in the San Francisco Bay Area, and we have lots of rail, you know, even commuter rail and other things that are near sea level. And there's going to need to be some sort of redesign of the transportation system to deal with that climate system. So what the climate change impacts have on the built environment, you see what's unmet needs to have that equity. And then finally, you provide resilience and reinforcement actions. So I'm just gonna, you know, because we have limited time, I'll just kind of talk through each of these and what's been happening, even in California here. So major focus areas, ride hailing and ride sharing. The issues that you'll find with ride hailing and ride sharing is, number one, a lack of accessible vehicles. When I say accessible vehicles, I mean usually wheelchair accessible vehicles, right? So you've got a ramp that comes out the side of a van, somebody rides in, they strap their wheelchair down. Ride sharing likewise does not have that for you know, shareable vehicles. Certainly doesn't have things like hand controls on minivans. And if somebody has a, you know, disability that somewhat affects, or that affects their legs, whatever, you know, when I bought my van, they told me that I could get a $50,000 adaptive driving system, considering I have kind of a high level spinal cord injury. I'm not going to do that, and the ride sharing folks are probably wary of doing that as well. And those are barriers that we need to work through and figure out. With ride hailing and ride sharing, it's also the business model that creates barriers. The disability community was furious about the fact that Uber does not have enough accessible vehicles, and they didn't. Uber then comes back and says, oh, we connect you know, customers to drivers, and the disability community said, you know what, that's not a go around for the ADA. And they actually had to go through the California Public Utilities Commission, which regulates transportation, or sorry, communication issues. So, you know, the ride sharing folks said, we are a communication company, and then it went through there, and now they're starting to add wheelchair accessible vehicles, but it's been a slow move. The other thing is bikes and scooters. These are, you know, number one, an issue for people who cannot easily, or cannot period, use bikes and scooters on their own. Are there things like hand cycles, tricycles, etc., that they can use? I hate that scooters are constantly in the middle of sidewalks and I have to find ways around them. That's not easy, that's not safe. You know, here in the Bay Area, we've focused on adding some accessible bicycles. But they're one-way directions, right? It's recreation, not transportation. And it is sure really, really hard to identify the need of the number of accessible bicycles and then match those up in a way that people can effectively go around town. Electric vehicles and micromobility, you know, great potential here, but in California, where we're talking about fully electric vehicles by 2035, I've still yet to see a wheelchair accessible van on a major market that is electric. So we need that. Micro-mobility, pod cars, there might be an issue, and actually I'm going to cover that in the next slide. And automated vehicles actually have barriers, but also have promise. Stage 4 and 5 would be fantastic for somebody who is blind or has a spinal cord injury or whatever it might be. But can somebody go in, strap their wheelchair in on their own? If there isn't a driver, well, there's another barrier. Things to keep in mind on that. I will say AVs actually are really useful for the blind community, but we'll need to figure out a way to kind of have the vehicle identify itself if it's picking someone up. So the last slide here, I stole an image from Dan on his last slide, which is this one right here. And just what comes to mind is look at these images and think about the accessibility. All the small cars right there, those wouldn't fit most wheelchairs, right? This is on the left. That bike lane might not work for wheelchairs. Someone who, has chronic pain and fatigue might not be able to ride a bicycle very far. They would need a vehicle. And what you see on the right in the kind of nightmare scenario, what stood out to me on this is there's these pillars for potential pod cars, and there's no elevator. I went to a conference not too long ago where there's all these pod car developers, and they say, well, if we have a stop and a station every block and a half, it's cost prohibitive to add elevators. And here I am waving my hand in the back saying, hey, I'd love to use pod cars, number one. And number two, you're violating the law by not following the Americans with Disabilities Act. So ensure that it is fully accessible. And that's going to have to be, kind of a cost versus effectiveness balance for a lot of transportation developers. So I'll leave it right there, especially because I know we have a lot of questions and about a half hour left.
Great, thank you so much. Fantastic presentations, and obviously I'm sure many of our attendees have a lot of questions as well. So let's get into questions for our panelists. Thank you again to all of you for bringing some really interesting perspectives. Let's see, so I'll ask that all the panelists now bring their videos back online, and we're gonna remove screen sharing so we can just have our discussion. So. So thank you all. Okay, great. So I think the first question that I want to bring up to this panel is probably one that's quite obvious. I think we need to address the issue of the pandemic and how that relates to the issues that we're discussing today. What are the considerations that we need to talk about pandemic relief, both during and after, and I think I'll have some follow-up questions, but I'll start there.
Dan, you want to go first? I was just after you guys. I have some thoughts, but happy to hear your thoughts first.
Well, I can say something like COVID offers an opportunity to see what will be the changes if we improve or we change our behaviors in terms of mobility, the flexibility to work from home, the lack of need to actually go to certain places, and the reduction of traffic and the all negative externalities of that. But also people is at home and they're not performing a lot of physical activity. They don't go to parks and do things because you supposed to don't be where all the people are, other people is. So so this is a problem. So we need to face what is the risk and benefits of this current situation to keep maximizing the benefits, the co-benefits of that, but also support and reduce the risks. And maybe around to expand bike lanes, expand sidewalks, so that people can walk there without the need to actually to be very near to each other, and to make certain information and signs that will be inclusive for everyone to know when to be in the parks where are less people, which kind of facilities they can use. So and try to improve the safety of those that actually work in buses and public transportation. So there is offered us a highlight risk and benefits, many things that we already know, but now everyone is aware of that. So I can expand more a bit, and what we are seeing in China, that many people who were users of public transportation, now they're shaped for cycling. They're more active transportation, but there are other group of people that actually starting to buy cars, and probably these new cars that they're buying are cars that are the more cheap version of the cars, with less traffic, less safety features, are more polluted probably. So if we shift the market in that way, we have problems that they will come in soon. So we need to see what will happen, and China is already providing us this kind of futuristic vision of returning home.
So people with disabilities are often, but not always, have pre-existing conditions which would make them more susceptible to serious effects of the virus. And then there's a correlation between age and disability. And I'm disheartened seeing so many prominent politicians and figureheads kind of discounting the lives of elderly folks and people with pre-existing conditions. So that's just kind of a first thing. I also want to give a shout out to Ray Leon for saying "Go Bears" for the flag behind me. But the second issue is people with disabilities are transportation limited. That we looked at I think the household transportation survey, and people with disabilities had 20 to 25% of households with someone with a disability don't have a vehicle. And people with disabilities use public transit. So you've got this thing where you've got a population that's already transportation limited and does not feel safe in public transportation. And it's just led to a lot of isolation. I was going by my local wheelchair shop yesterday, and there was a sign on the front saying we're closed because of COVID concerns. And someone on that sign wrote a very impassioned curse word on it because people with disability, if your chair isn't working, you're not going to be able to go down that sidewalk. You're not going to be able to go down that bike lane. And you're going to be even more transportation limited in a time where transportation is number one dangerous and number one even more limited, right? So it's a concern. It's a big concern, and finances for people with disabilities, they don't have, on average, the amount of money to go out and buy their own vehicle and have someone drive them around. So yeah, it's a conundrum.
Yeah, I definitely support, I concur with what David and Alex are saying. And I think I mentioned, some of the implications and kind of concerns that have been raised in the current pandemic setting. So I think there's, looking at, right, the near-term needs and the potential for these types of services and technology to help. We're seeing, as I shown in Sacramento, the use of delivery AVs. I think there's another case in the South Bay, if I'm not mistaken, delivering food to food banks. And so in limited capacity, we're seeing the deployment already in response to COVID. Longer term recovery, there's also, kind of looking broader at just how our built environments, our communities are designed and planned, right? Like, why is it that there is so much dependency on auto use, period, and I think you're seeing a lot of local communities put forth, the slow streets and expanding, these kind of pop-up and makeshift bike lanes and just closing streets to driving and to expand that. So I think it just touches upon just broader questions around, like, really truly providing multimodal mobility options, like having the services and housing, jobs, all of that within reasonable distance where you don't have to rely on vehicles to travel there. The added benefits, you can be outdoors. That limits some of the risks for transmission. You look at public transit, right? That really has the transit service and use has really dropped a lot during the pandemic, right? There are a lot of perceived safety concerns. And on top of that, a lot of our frontline workers are oftentimes, those who are most reliant on public transportation options. They also tend to be, people of color, or, just a lot of that intersectionality of challenges and inequities that we're seeing. So it raises a lot of questions around, like, how do we want to recover and build back? And in our health equity discussions, we often say, we don't want to go back to normal, right? Like, normal has all these inequities, the things that aren't working for so many of our population groups. How do we recover in a way that advances equity, advances health, and sustainability, right? At the state level here, a lot of the signals have already been sent, and with Governor Newsom's announcement yesterday, 2035 banning the sales of gas vehicles, there are a lot of signals towards electrification, zero emissions. So that will definitely have co-benefits for health. The less exposure to air pollutants, that can help to reduce your susceptibility to respiratory conditions, or help to address some of those or prevent underlying conditions, so that that ties into your risk to COVID and other respiratory diseases. So a lot of this is interconnected. So just looking at the bigger picture, how can the three revolutions be a means or a tool to facilitate healthier, safer environments, both in the immediate terms and the longer recovery.
If I can jump in for
please.
one really quick thing, we're going to have more people with disabilities, and the budgets for public services and potentially, the longevity of Social Security, retirement, and SSDI are in limbo right now. So all of this, the financial constraints, the demand on the system for disability services is going to grow. And that'll hit transportation.
Absolutely. Actually, that's a great lead into my next question about, let's zero in on this issue of funding, and how will changes in the available funding sources affect both the government response to the COVID crisis, and also the government response to larger public health issues. And I guess relating that to mobility if possible. I know that's a big, broad question, but we don't want to address every single issue, but focusing in on some of the mobility challenges and how those may be affected by.
Well, I think at least within the MTC footprint, Metropolitan Transportation Commission is the 9-county Bay Area. And I think it's a statewide law that local transit agencies need to have a 20% fare box recovery, something like that, right? And the fare box recovery for paratransit is like zilch, because it's expensive and otherwise. So yeah, there's going to be budget crunches on a lot of fronts, and I think that investment in long-term solutions that end up being more cost-effective, and things like micromobility and pod cars. I hate to take business away from conventional public transit, but it will provide more options and diversify.
Yeah, I was just gonna say there's a lot of question marks, right, around the funding. I've been hearing discussions about transit agencies and how do you kind of emerge from this or sustain themselves. I don't have necessarily the answers, or that a lot of folks are working on this, but I think the bottom line is that at least in the foreseeable future as we recover, we have to do more with less, and kind of maybe looking at some of those strategies that have the most benefits that can come out of it altogether, right? And looking at what makes sense for the communities, for again, health benefits. Some of these aren't necessarily like high tech or high cost solutions, right? A lot of these expanding of access to walking or cycling are things that can be done quickly and at relatively lower cost. And so kind of thinking differently around how to use limited resources.
I think I totally agree with what Alex and Dan mentioned, that tactical urbanism is cheap and it's a great way to start. And we don't need a lot of budget for that. And we can test many solutions, and maybe that will help us to implement in the future what we want as a city, as a streets. Thinking that public health innovations in public health now will be very economic effective in the future. So it's worth it to invest now in terms of public health, and all these interventions that provide more health benefits will provide economic benefits in the future, larger economic benefits in the future. So take that consideration. And there are many opportunities in try to include the industry in that process, to try to see how the industry can be more active in that process, to invest in these kind of solutions, to bring funding for that part too. So partnerships there, I think, are essential now more than ever, because we don't have a lot of budget in the public places.
Right, exactly. Yeah, and I definitely think that going back to something that Dan said about this sort of return to normalcy is not the objective. I think return to normalcy, even in the previous funding climate, is not the objective either, right? We need more resources dedicated towards shared mobility. And we can't look to transit operators or shared mobility providers to solve the problem. It is a bigger problem that we need to leverage funds to address. So I'm going to turn to another of the sort of biggest elephants in the room, which is the climate, crisis. And we've addressed this, and all the speakers have addressed this a little bit. But I want to speak specifically to this sort of issues around wildfires, air quality. One of the Q&A questions came in about asthma. What are we seeing as the what are the public health strategies that we can do to mitigate some of the climate effects that are happening? To Alex, it looks like you have your.
Stop building at the urban wildland interface, please. Yeah, it's everything is. Urban policy needs to be more integrated. We really need to have things like transportation-oriented or transit-oriented housing. I do think we need more density, less sprawl, pulling away from the urban wildland interface. What we found in with the wildfires here is people with disabilities and elderly folks are most likely to, number one, get hurt or die. It was 75%, something like that, of the deaths in Paradise were seniors. So it's huge. People who are transportation limited, a lot of times paratransit is not going out to evacuate people from wildfires. You can't easily locate if somebody's evacuated or not. It's a whole mess on that front, and a ton is related to transportation and evacuation. And I think, affordable, accessible, like pod cars speeding to pick people up from a fire danger zone is totally legitimate. I think if we can have, more efficient safety and evacuation measures, then and somehow include that in 3 revolutions, like that's huge.
Yeah, I think resiliency and the 3 revolutions actually can go hand in hand, and there's some efforts happening to ensure that when we're looking at these solutions, we're not looking at just simply tech fixes sort of for fun, but really to address some of the biggest public problems, which is the fact that some populations are more vulnerable to issues around such as wildfires, floods, etc. So So we need to think about how those tech solutions can address those problems. I don't need to everyone to answer, but would anyone else like to address this question around wildfires?
Yeah. I was just gonna kind of talk from also like a higher level, just how we approach it, like just looking at climate change, in the public health world, and other sectors, is wide recognition that climate change is one of the greatest health threats of our time. And the flip side is then taking action to address climate change is one of the greatest opportunities that we have to advance public health equity and a lot of these other things that we want to see improved. And so, our program works both on the climate change mitigation side and the adaptation side, really focusing on building community resilience, right? So there's a lot of different strategies. We mentioned electrification, reducing emissions. That's a big part of it, but also, again, as Alex touched upon, how do we just plan better and design better, looking at a lot of the existing systems and policies that haven't been working, like that has promoted, developing further and further out, that we are continuing to be extracting and utilizing resources very inefficiently. How do we kind of shift a lot of that thinking towards health equity co-benefits, utilizing kind of a health and climate equity lens to all of our policy decision making. From the adaptation and resilience side of things, our program has developed a set of climate change and health vulnerability, so medical vulnerability indicators. But the point here is looking at the census tract level or the smallest scale that we can get to, where are the areas that are more at risk for different climate impacts, wildfire, worsening air quality, sea level rise for coastal communities, right? Targeting those communities, and we work with our county health departments really around adaptation planning. How do you, establish like plans ahead of time? Who are the populations that you really need to make sure you're connected with? How do you reach out? You have, in-home visitation nurses, promotoras, and other community health workers that are very connected to the community. And so how do you tap into that local knowledge to inform, who is at risk? How do we help get them out? What are the challenges, including transportation, mobility challenges? Also, from the infrastructure adaptation resilience side, like a lot of the attention has been focused on kind of that hard built infrastructure, concrete, metal, and all that planning and design, which is very important too. And looking at, what are the areas that are continuing to be more and more at risk that we need to, the idea of like a managed retreat and re-looking at our infrastructure, but then also looking at the social infrastructure, the how communities are connected with each other. What are their thoughts and what are their immediate concerns and problems, and helping identify and locating and thinking of solutions too, right? I think there's a recognition that like government needs to be in partnership with the stakeholders and those who are at most risk and at potentially most impacted, but also they are a lot of where the solutions need to come from, and so I kind of come back to the community engagement and really having it be meaningful and not just hearing input and leaving, but how do you actually implement and make decisions happen and see real change, and that's definitely a work in progress, but that's something that from a health equity perspective we're always trying to advance.
Really quick thought, because we have limited time, but beware public safety power shutoffs and what that might do for electric dependent, mobility, and even things like ride sharing that uses cell phones. If the cell phone towers are down, the public safety power shutoffs, these are to make sure that power lines don't spark wildfires in California. That will affect transportation, so we need to keep that in mind. Hopefully those won't last too long.
So I think I'm going to turn to our final question. So thank you all to the panelists for digging into these topics. But my final question, I wanted to leave on a personal note. So I just wanted to dig in to sort of think, to share with the panelists, share with the audience, why you do this work and why you feel motivated to continue to do your work. And leave us with that. And hopefully we can find some strings of hope in those Please turn first to David. Can you please share with us why you do your work and what motivates you to continue?
Yeah, thanks. Well, my background is I'm MD by training. I'm actually a gastrointestinal surgeon. So after work in hospitals for several years, and find out that the patients don't follow the recommendations and mostly don't follow the recommendations from the doctors is because they don't have the possibility to change their lifestyles, their behaviors. They have access to healthy food, their workplaces, they don't have time. So I see many patients in that situation that we were unable to help them until they go back to the hospital and require more interventions and adding risk in their lives. So I thought like public health is actually the solution. And so that's the reason I'm focusing in on public health and epidemiology to try to prevent the cause of the problems. It's not so the clinical medical vision is like if we not improve the urban environments, the places where they work and live, they will not be able to actually reduce and manage these risks. So I keep myself here because I see a lot of opportunities. I'm very optimistic that we can help a lot. All the gaps that we see are opportunities for health. So we can shape that message like everything that we see bad. We have a lot of air pollution. This is a great opportunity that we can win from health if we improve that air quality. So, and that aspect will affect the physical activity, traffic injuries, the vegetation, nature, design, transportation, and these three revolutions are a great opportunity for public health from my perspective. Yeah.
Thank you for that. So I will have to ask for you to give super short answers because we have just a couple minutes left. But Alex, will you share your final thoughts here?
Sure. So I got into climate change and disability because I worked at the California Energy Storage Alliance for a while, and it was the idea that if we have all these solar panels, we'll need a battery so that I can charge my own battery at night, right? So that was a wake-up call. That's when I got into disability rights work. I will proudly call myself a perpetual cynic, and I think that the cynical calls for adaptation that I've been like waving my hands about have been kind of right and played out pretty well. So not to like pat myself on the back, but we need to prepare. We need to prepare in advance. This is just, and for me, you know, social justice activists work as they do. I'm not gonna pretend that there's not a little self-preservation in there to try to save people with disabilities, but it's you know, it's social justice and realizing the gravity of the issues that we're facing.
Absolutely. So Dan, please final thoughts.
I'll sum it up. I did a Google search maybe about 10 years ago and basically concluded that like climate change was the biggest problem facing humanity, period. And so I decided I wanted to work on climate change. And then public health, I came from the design and planning world, green buildings and all that. And I just thought, you know, it kind of just eventually became clear public health was kind of the bottom line for everything, right? Like my grandma used to always say, like, without health, there really isn't anything else. You know, first you gotta get your health okay. And so that applies to the individual population and planetary health. And so climate change and health, and that's how I came to work at the CDPH's team on addressing that.
Well, thank you all of you for sharing all your thoughts with us. We did run over a little bit of time. We weren't sure whether we were going to finish at 11:45 or 12. And thank you all for staying. For those of you who stayed on with us till the end, we really appreciate you joining us. And we will share with you by email the slides and information about our upcoming webinar on rethinking public space. So please join me in thanking our panelists. We really appreciate you joining us, and we'll see you next.